Hello everyone. Today I'll give you an overview of the Ontario Human Rights Commission's policy on preventing discrimination based on mental health, disabilities, and addictions. I'll cover key parts of the policy and there will be time at the end for questions and answers. I'll start with a short background to the policy. From 2009 to 2011, the Ontario Human Rights Commission held a province-wide consultation. Over 1,500 individuals and groups took part, including people with mental health issues or addictions, employers, service providers, housing providers, advocates, families, and others. Based on these consultations, the Ontario Human Rights Commission prepared a consultation report entitled Minds That Matter. In it, we committed to developing a policy on mental health and addictions. In 2014, the OHRC released its policy on preventing discrimination based on mental health, disabilities, and addictions. The policy sets out how the Ontario Human Rights Code, known as the Code, applies to mental health and addictions issues, and it provides many practical examples. Barriers exist across society, and our policy focuses on employment, housing, and services. Ableism, negative attitudes, stereotypes, and stigma can create barriers in society. These attitudes can lead to inaccurate assessments of people's personal characteristics, and in turn may lead to policies, procedures, and decision-making practices that exclude or marginalize people with mental health, disabilities, and addictions. Stereotypes related to violence persist, even though studies show that most people with mental health disabilities are no more likely to engage in violent behavior than the general population. In fact, research shows that people with serious mental illnesses are more likely to be victims of violence themselves than other members of the general population. People with mental health issues are often seen as childlike and in need of help, even when this is not the case. They are viewed as not having the capacity to make decisions in their own best interests. Extreme stigma around certain types of mental health disabilities and addictions may make people afraid to disclose their disability. For example, in our consultation, we heard about a librarian who was so afraid to ask for accommodation for her mental health disability that she chose to quit her job instead. Fear of discrimination can also result in people not seeking support for a mental health issue or addiction. The policy states clearly that ableism, negative attitudes, stereotypes, and stigma that result in discrimination violate the Code. The policy sets out the legal framework of protections for people with mental health, disabilities, and addictions. It goes through the rights and responsibilities set out under the Ontario Human Rights Code. It points out the impact of the Charter of Rights and Freedoms, the Accessibility for Ontarians with Disabilities Act, and the United Nations Convention on the Rights of Persons with Disabilities. The policy then goes on to discuss intersecting grounds, inclusive design, and forms of discrimination based on mental health and addiction. Intersectional discrimination occurs when discrimination is based on two or more code grounds, which results in a unique or distinct experience of discrimination. Intersectional discrimination recognizes that people's lives involve multiple interrelated identities, and sometimes people may be marginalized and excluded based on how their identities intersect. For example, in our consultation, we heard that young African Canadian men with a mental health issue may face specific barriers when renting housing because of intersecting stereotypes about sex, age, race, and disability. People with mental health and addiction disabilities are also more likely to have low incomes, and many live in chronic poverty. The policy also looks at the importance of designing society and structures with the needs of people with mental health and addiction disabilities in mind. For environments that are free from discrimination and harassment, organizations must take steps to design programs, policies, and environments inclusively. This means taking into account the needs of people from diverse backgrounds who have a range of unique identities. Here's an example. A hospital emergency department has a list of language interpreters who are available by telephone. This means more efficient service to people whose first language is not English and who may need attention for a mental health disability. Discrimination based on mental health and addictions can appear in different forms. Direct discrimination happens when individuals or organizations specifically exclude people because they have a mental health disability or an addiction. For example, an employer fires a woman after learning she has depression because he doesn't think she can do the job. Indirect discrimination is carried out through another person or organization. For example, an employer that uses an agency for employee recruitment tells the agency to screen out anyone whose work history indicates that they have or have had mental health issues. Discrimination against people with mental health disabilities or addictions is often subtle. Generally, people will not freely voice stereotypical views about people with mental health disabilities or addictions as a rationale for their behavior. And sometimes rules, standards, policies, practices, or requirements that seem neutral have an adverse effect on people with mental health and addiction disabilities. An example is an employer that won't hire anyone who has a gap in their employment history. This could have a negative effect on people whose mental health or addiction disabilities have temporarily kept them out of the workforce. Discrimination may also include profiling. Profiling is based on preconceived ideas about a person's character. People who have or are perceived to have mental health or addictions issues are sometimes treated as a risk to public security and safety, even when there is no evidence to support this perception. Harassment. Discrimination also includes harassment based on a mental health or addiction disability. Harassment can happen at work, in housing, or when receiving different types of services. Poisoned environment. The policy also talks about poisoned environments and systemic discrimination. And it talks about reprisal. It's important to note that the code protects people if they experience reprisal or threats of reprisal. A reprisal is an action or threat that is intended as retaliation, punishment, or payback for claiming or enforcing a right under the code. This would mean that someone could not be punished by their employer, for example, for raising the issue of human rights or attempting to enforce their human rights in the workplace. Even programs, laws, and policies that target, serve, or benefit people with mental health disabilities or addictions may be under-inclusive or engage in questionable human rights practices. For example, the Ontario Disability Support Program, known as ODSP, was successfully challenged in court because it specifically excluded people with drug and alcohol addictions. The Ontario Court of Appeal found that it is well known that people with addictions and welfare recipients are subject to stigma and prejudice, and that there was no obvious explanation for why this group was not eligible for benefits under the legislation. Measures that apply distinctly to people with mental health and addiction disabilities must ensure equality, respond to people's individualized needs, and uphold people's dignity. They should never be used as a way to continue inequality, segregation, or exploitation. The policy talks about the duty to accommodate people with mental health disabilities and addictions under the Ontario Human Rights Code. There are 3 principles of accommodation, and these are 1. Respect for dignity, 2. Individualization, and 3. Integration and full participation. The policy also sets out the duties and responsibilities in the accommodation process. A person making an accommodation request should be making their needs known to the best of their ability, taking part in the accommodation process, and answering relevant questions about restrictions and limitations. It also talks about the responsibilities of organizations. An organization should accept an accommodation request in good faith, unless there are legitimate reasons for acting otherwise, take an active role throughout the process, and get expert advice when it's needed. The OHRC has been asked about the kind of information an organization can ask for from a person who has a mental health issue or addiction and is requesting accommodation. Asking about medical information has implications for the privacy of employees, tenants, and service users. Yet, at the same time, organizations must have enough information to meet their duty to accommodate. The policy states that a person requesting accommodation is generally expected to provide information to show that the person has a disability or a medical condition, and that outlines the limitations or needs associated with the disability. Where more information is required, questions must be the least intrusive of the person's privacy while still giving the accommodation provider enough information to make the accommodation. In general, the duty to accommodate a disability exists for needs that are known. Accommodation providers are not, as a rule, expected to accommodate disabilities that they don't know about. Sometimes, however, the nature of a mental health or addiction disability may leave people unable to identify that they have a disability or that they have accommodation needs. People may not want to disclose their disabilities because of the considerable stigma surrounding mental health issues and addictions. Accommodation providers must try to help a person who is clearly unwell or perceived to have a mental health disability or addiction by inquiring further to see if the person has needs related to a disability and by offering assistance and accommodation. This must be done before imposing discipline on a person. Under the Code, mental health and addiction disabilities must be accommodated to the point of undue hardship, which is a very high standard. The Code sets out only 3 factors that may be considered in assessing whether there is undue hardship. They are cost, outside sources of funding, if any, and health and safety requirements, if any. Let me explain. Cost involves the expense to the organization to make the accommodation. To meet the undue hardship standard based on costs, the cost must be so high that it affects the viability of the organization, such as impairing the operation of the business. Outside sources of funding is funding that is available to help offset the costs of the accommodation. And significant health and safety risks may also cause undue hardship. The Code recognizes that the right to be free from discrimination must be balanced with health and safety considerations. Organizations should not jump to the conclusion that a person poses a risk without objective evidence, and it's important to consider the dignity of the person when addressing health and safety risks. Even where people are correctly assessed to pose a risk, organizations should apply a proportionate response. If a real risk exists, the least intrusive means to address the risk must be used. The policy states that a high probability of substantial harm to anyone will amount to undue hardship. Most often, it will not cost much to accommodate someone's mental health issue or addiction. Accommodation may simply mean making policies, rules, and requirements more flexible. The policy recognizes that the power to make decisions about matters that affect one's own life and to have them respected by law is a fundamental part of realizing one's rights as an independent adult. Capacity issues can affect a person's ability to make decisions about getting married, managing property, personal care, health care, whether to receive treatment, consenting to go to a long-term care facility, instructing counsel, etc. People with mental health and addiction disabilities who lack capacity are often highly vulnerable to mistreatment. The policy states that organizations and institutions dealing with people with mental health and addiction disabilities should recognize that people who lack capacity may be more at risk for exposure to exploitation and abuse, particularly if they are isolated from social supports, do not know their rights, or have people acting on their behalf who are in a conflict of interest. Ontario has legislation that deals with aspects of decision-making and mental capacity. It's important to note that the Code has primacy over other provincial legislation, which means that these pieces of legislation must have regard for the Code and human rights principles. The policy states that employers and those providing housing and services have the ultimate responsibility for maintaining an environment free from discrimination and harassment. It is not acceptable to choose to stay unaware of discrimination or harassment of a person with a mental health disability or addiction, whether or not a human rights claim has been made. The section on preventing and responding to discrimination sets out concrete steps that organizations can take to ensure that they are acting in accordance with human rights principles. These steps include preventing, reviewing, and removing barriers, data collection and monitoring, developing human rights policies and procedures, and providing education and training. To conclude, the OHRC's policy is intended to provide clear, user-friendly guidance on how to assess, resolve, and prevent human rights matters related to mental health and addiction disabilities. All of society benefits when people with mental health and addiction disabilities are given equal opportunity to take part at all levels.